The knee, it's where it's at. It's where you bend and snap. Femur, tibia, fibula, patella. Connected by ligaments, they all come together.
The cruciate ligaments cross at the center. Anterior and posterior are attached forever. The ACL prevents the tib from going forward. The PCL prevents the tib from going backwards. If you step on your foot and it lands the wrong way, your tibia will be sure to sway. If you get into a car accident, it won't make your day. It will push your PCL the wrong way. To assess the pain, you need special tests. The anterior and posterior draw tests are the best.
The collateral ligaments we will talk about now, bending by the medial and the lateral, they will show you how. Valgus movements are prevented by the medial, varus movements are prevented by the lateral. Hit by a valgus force, your MCL will tear. Hit by a varus force, your LCL can tear, although it may be rare. With both injuries, you're sure to be aware. A valgus and varus stress test should be there.
The menisci are shaped in two different ways. C-shaped or U-shaped, tearing either one will ruin your days. The Apley's test will be sure to amaze. You may hear a pop or a click, but hardly any pain. Orthoscopic surgery will be your only gain.
A dislocated patella will make you an unhappy fella. You must strengthen your VMO if you want to get better. If the bone pops out and comes right back in, it's a subluxation, so be sure to see Lynn. She will perform the apprehension test, which will be sure to win.
Between the patella and the tibial tuberosity, the patella tendon lies. If inflammation occurs, you're sure to cry. To get rid of patella tendonitis, you must do a few things. Stretch, strengthen quads, ice, and drug up so you don't have to give the doctor any rings.
If the patella is not riding correctly in the femoral groove, you'll hear crunchiness when you try to move. If you think you have it, do what's best. Take the patella compression test. Enough about this, let's move on to some muscles. It won't take very long. They're not fairly as complicated as some of those puzzles. 4 quads and 3 hamstrings will be our main concern. Let's go through each one, giving each a fair turn.
Rectus femoris comes first, starting at the hip until the end of the knee. The vastus intermedius is covered by knee. The vastus medialis and lateralis are found on each side. When all 4 quads come together, they may seem very wide.
The tibial tuberosity is where they all attach. The patella tendon connects them to make a good match. The semitendinosus and the semimembranosus may cause some confusion. Attaching to the fib and looking identical, we've come to our conclusion.
On the opposite side, we see the bicep femoris. Although it may be alone, it's too important to miss. If you think you've pulled a muscle, be sure to check it out. The active and passive range of motion test will help you, no doubt. Some neurological tests may be beneficial too. Just ask Miss Bongo and she will tell you what to do.
Now for the rehab, that's the termination of this all. A physical therapist can help you out if you just give them a call. We must first control inflammation. Ice will be your best bet. A knee cryocuff may be used, or even a cold whirlpool with a jet.
Once the inflammation goes down, less increased range of motion, passive and active will do depending on if you have locomotion. Easton will stop the pain and towel stretches will help. Beware, there may be pain. You may yell out and yell.
Stretching is so important, strengthening as well. Quadriceps, wall sits, step-ups and down are all beneficial. It's up to you to tell. Once we're back in shape, let's get ready to play. It's most likely been weeks that you've been waiting for this day. Sport-specific exercises must be done now. Once you're done with the step, you deserve to take a bow. Hope you didn't forget cardiovascular along the way. If you did, I can't say you'll be okay. It's been a long recovery, but in the end you turn out fine. We just wish that